Hi guys, for all of us who are preparing for the SCA, which of course is the final exam of the Rcgp that makes you a qualified GP or family physician, as the case may be, in the United Kingdom. So the Rcgp marking and results. So this is from the Rcgp website. So marking and results for the SCA, the simulated consultation assessment. I believe this is actually the blueprint. This is actually what the examiners will be looking out for. These are the standards expected of anyone who is going to pass the SCA and become a GP, qualified GP. I read. Each case will be marked in 3 domains: data gathering and diagnosis, clinical management and medical complexity, relating to others. Each of these 3 domains will be awarded one of the following grades, listed here with their associated definition relative to the standard of the Rcgp. Clear pass. This domain is clearly demonstrated above the standard of a newly qualified independent GP, which means you've performed so well, even at a level that is above the level of someone who is at the end of an ST3 training. Pass. This domain is sufficiently demonstrated at the standard of a newly qualified independent GP. Essentially, all you need is to be at the level of pass across all your domains. Fail. This domain is insufficiently demonstrated at the standard of a newly qualified independent GP. And then the last one is clear fail. This domain is clearly demonstrated below the standard of a newly qualified independent GP. What does this mean? This means that at the SCA, the examiners don't want to see an ST3 GP trainee. They want to be seeing a qualified GP. So when you're assessing, when you're discussing with those actors or patients, the examiners want to be seeing someone that they can confidently employ as a salary GP or as a locum GP at their practice. That's what they want to see. They don't want to see a trainee. They want to see you performing as a qualified GP, as a competent general practitioner. Standard descriptors. Guidance on the passing grade, otherwise called the standard, for each of the domains as used by the examiners themselves is as follows. For data gathering and diagnosis, passing level, the candidate systematically gathers and organizes relevant and targeted information to address the needs of the patient and their problems. The candidate adopts a structured and informed approach to problem solving, generating an appropriate differential diagnosis, or relying on first principles where the presentation is undifferentiated, uncertain, or complex, which means you need to have a structure. You need to systematically gather. You have to be organized, and you have to cover relevant aspects of your data gathering, your history taking. And in situations where you're not very sure what's going on, where the presenting complaint is a bit vague, where there are so many things that could be causing this, the way you're able to communicate these uncertainty and the way you're able to navigate through this uncertainty throughout your data gathering and even management needs to be clearly shown. It needs to be systematic. It needs to be reasonable, the way a qualified general practitioner should and would approach such undifferentiated cases. On data gathering, the candidate systematically gathers information using questions targeted to the problem, ensuring patient safety. The candidate establishes the presence or absence of red flags. Very important. For instance, a patient is having a cough, chronic cough that's lasting longer than 3-4 weeks. You need to be checking any red flags, any weight loss, a coughing up blood, hemoptysis, any drenching night sweats, those kind of questions. Any loss of appetite, you're excluding red flags. If it's back pain, any urinary dysfunction, any numbness, are you aware of, do you feel it when you wipe? Any saddle anesthesia, any weakness in your legs and things like that. Urinary retention. So the candidate establishes the presence or absence of red flags. Very important. The candidate elicits relevant psychological and social information to place the patient's problems in context. So asking relevant social questions, smoking, alcohol, occupational history, family history, things happening, and of course psychological questions as well. How is this affecting you? How's your mood been the last few weeks? Under making a diagnosis, the candidate uses a structured and evidence-based approach to diagnostic reasoning. Candidate uses an understanding of probability based on prevalence, incidence, and the natural history to aid decision making. The candidate revises hypotheses as necessary in the light of additional information. The candidate addresses problems that present early and or in an undifferentiated way by integrating all the available information to help generate a reasonable working hypothesis. What all of these are saying is you need to be structured and reasonable. Apply reason. It needs to be clear to your assessor, to the examiner, that you're thinking straight, that you're thinking right, that you're bringing the different pieces of the puzzle together to reach a reasonable and likely working diagnosis. It needs to be clear that this is, you're thinking straight, you're thinking right, you're piecing things together. We move to clinical management and medical complexity. Passing level. The candidate demonstrates the ability to formulate safe and appropriate management options, which includes effective prioritization, continuity, and time and self-management. You demonstrate the ability to formulate a safe and appropriate management plan. That's what they want to see. The candidate demonstrates commitment to providing optimum care in the short and long term, whilst acknowledging challenges. So in cases where you need a follow-up, you need to be able to arrange a follow-up. Even when for instance, if you're admitting a patient, you need to be telling the patient, I would like to catch up with you when you're discharged. So we can talk about, go through any questions you might have and help and discuss ways we can improve your health in general. So that's leaving the consultation in such a way that I want you to come back. Let's catch up. Let's find out why this thing happened in the first place. Are there things we can do to prevent a relapse, for instance? Clinical management. The candidate considers a wait and see approach where appropriate. So you don't always prescribe medications. In situations where you may need to observe, give it 1 or 2 weeks and see how things go. For instance, a patient who has a cough or who has runny nose, symptoms of a possible viral pharyngitis, the patient is not very unwell, and you're saying, okay, fine. It looks like your symptoms are abating gradually. Looks like things are resolving. Let's give it a couple of days and see how things go. However, if you start becoming unwell, I want you to come back. Okay, so the watch and wait approach, where safe. The candidate encourages patient understanding, skills, and confidence with suggestions for self-care or lifestyle modifications. The candidate applies local and or national guidelines, including for medication and non-medication therapies. So you could apply your local guidance or guidelines. It's appropriate, but most local guidelines in the UK are tailored in line with the NICE guideline. There might be slight modifications to meet, available resources locally. But overall, even your local guidelines are designed to be safe and appropriate. So there's nothing wrong, actually, if you apply your local guidelines. Of course, it needs to be reasonable. It needs to be safe. That's the most important thing. It needs to be safe. Your management plan needs to be safe, and it needs to be rational, which means it needs to make sense to anyone that hears it. So any examiner that listens to what you're saying needs to say, yeah, this guy is making sense, or this lady is making sense, this candidate is making sense. The candidate demonstrates principles of safe prescribing. Safe prescribing means if you're not sure of the dose of a medication, or you can tell the patient, I'll prescribe you an antibiotic. Have you got any medication allergies? I wish to prescribe you an antibiotic called amoxicillin. If you're not sure, I'll double check the dosage and I'll send a prescription to your preferred pharmacy. So if you're not sure of the medication dosage, rather than confabulating, which is a medical error, a serious medical error, if you're not sure, say I'll double check the exact dose and I'll prescribe this medication for you. The candidate refers when required, being mindful of available resources. You need to be aware of limitations in the NHS, right? There's no healthcare system that has everything available at every point in time. Resources are not always available. So you need to refer where appropriate, and you need to see if there are things you can safely manage in primary care, you manage them in primary care. The candidate suggests safe and sensible follow-up arrangements, as well as continuity of care. The candidate ensures care is coordinated within the practice team and or with other services where necessary. For instance, a patient who is asthmatic or has COPD or is diabetic, encouraging them to book an appointment with a practice nurse to go through their inhaler technique and maybe to modify their inhaler contents. For instance, if they're on Trimbo, for instance, they might need the steroid content of their inhaler, increased. Things like that. The candidate varies management options responsively according to the circumstances, priorities, and preferences of all those involved, which means, for instance, you're offering different management options to the patient, and the patient is making different choices or making different preferences. Your ability to be flexible whilst remaining safe and rational in the advice and the options that you give your patients. The candidate makes safe, evidence-based decisions that are defensible even when difficult. Sometimes we encounter difficult consultations as primary care physicians. A patient who wants, for instance, opioid medications at a dose or frequency that you deem inappropriate. You might have a difficult consultation declining that patient's request for that medication. But as long as you are safe and your decision is defensible, you can defend that decision, that's the right thing or safe thing to have been done at that point in time. You are a good doctor. The candidate thinks flexibly around problems, generating functional solutions. So they want to see someone who is able to think, who is able to navigate safely around differential diagnosis, around the cues and clues the patients will be giving you, or in this case, the SCA, the actors who are the patients in that scenario. So your ability to think aloud. Oh, you've mentioned this. Could it be this? I'm just wondering if you could have polymyalgia rheumatica because of the kind of pain you're describing and the stiffness which you're experiencing in the morning in your shoulders and around your hips. I'm just wondering. So you're wondering, you're thinking. Okay? So they want to see you thinking. They want to see you putting the pieces of the puzzle together in a rational way. We move to medical complexity. The candidate prioritizes management options based on an understanding of risk. The candidate manages uncertainty, including that experienced by the patient. The candidate adjusts care as necessary in the management of multiple problems, recognizing the implications of multi-morbidity and polypharmacy. Your ability to remain flexible, your ability to think and prioritize. Patient has different problems. Which one do you need to address right away? So, for instance, a patient is having chest pain, a patient is having calf pain, you're thinking this patient might be having a DVT, and the patient is having maybe a fungal nail infection. Obviously, you need to be prioritizing the suspected DVT over a fungal nail infection. So your ability to prioritize. The candidate manages health improvement, rehabilitation, prevention, and health promotion. For instance, talking about weight management, talking about dietary changes, smoking cessation, advising the patient on the need to cut down on alcohol, on the need to exercise, those kind of health promotion advice where necessary, referring a patient for physiotherapy, thinking about involving the occupational therapist, speech and language therapists, so bringing in other specialists where necessary. Practicing holistically, promoting health and safeguarding. The candidate engages support agencies targeted to the needs of the patient and or their family and carers. For instance, involving social workers, involving the social prescriber at your practice, involving hospice, talking about hospice care in a patient who is palliative or approaching or palliative or end of life, The candidate recognizes and responds to adult and child safeguarding concerns, including ensuring information is shared and referrals are made when required. Relating to others, passing level. The candidate demonstrates ethical awareness. For instance, ethical awareness, you might need to ask certain questions to a teenager and the parent is there. You might want to check if the teenager is happy for the parent to step aside for a few minutes for you to ask some confidential questions. The candidate shows ability to communicate in a person-centered way. Person-centered way means the patient is at the center. Your job is to want to help that patient. I'm not sure why my beard is itching. Your job is to want to help that patient, and that's it. Everything you're doing, your communication, the discussions should all be tailored towards improving that patient's health. The candidate demonstrates initiative and flexibility in using various consultation approaches in order to overcome any communication barriers and to reach a shared understanding with the patient. So the candidate demonstrates initiative and flexibility. So you have to be flexible in your thinking. You have to be flexible in the way you think about what the patient is saying. You have to be flexible in the way you maneuver and navigate through your differential diagnosis. You have to be flexible in the way you discuss your management options with your patient. You need to be flexible in thinking, should I be discussing safety nets here? Should I be booking, arranging a follow-up? You need to be flexible. There's no room for a rigid thinking as a GP. You need to be flexible. You need to be safe. You need to be rational in everything you do. Fitness to practice. The candidate shows respect for patients, treating them fairly and without discrimination. The candidate takes ownership of decisions and with confidence, whilst being aware of their own limitations. So what it means is you need to be able to make a decision. You need to be able to convey management options to a patient. And when a patient should ask you certain questions, you need to be able to give them. You don't need to panic, essentially. You don't need to panic and say, I need to speak with my supervisor, or I need to speak with my colleagues. It's a good idea to speak with colleagues to get second opinions. But you need to also be confident in your ability as a doctor, as a general practitioner, or family physician, as the case may be, in helping your patient navigate through several management options, guiding them on the pros and cons of those management options and helping them reach a rational, reasonable decision. And you have to be able to own up to those things and say, yes, I advise this patient on this, not shying away or running away from taking responsibility for what you've done, for the job you've done. Maintaining an ethical approach. The candidate recognizes cultural and personal differences in patients and/or colleagues. The candidate recognizes that everyone has their own values and beliefs. The candidate acts non-judgmentally with equity and fairness. And I want to add kindness. So no matter who your patient is, no matter what your individual belief system is as a doctor, about patient preferences, for instance, you have to treat them with dignity, kindness, be there for them, find out what their problems are, how can you help them, find out how best you can, work with them towards alleviating their problems and guiding them on the available path to find solutions. The candidate recognizes and respects patient autonomy. The candidate acts with beneficence and in the patient's best interests at all times. The candidate shows awareness of medical legal concepts such as informed consent, mental capacity, and best interests of the patient. These will come in handy when you're discussing patients with advanced dementia, patients who are palliative and end of life, patients who probably have got to a point where they might lack mental capacity, and some of those kind of cases could be brought in the exam where you're discussing with a nurse who works in a nursing home, or a staff in a nursing home, or the carer of a patient who has dementia. And you might need to clarify that this patient has or lacks capacity, in certain crucial decision making. Communication and consultation skills. The candidate explores and clarifies the patient's agenda, health beliefs and preferences. You need to find out why the patient has come. Very important. What do they want you to do for them? The candidate responds to important, significant cues, verbal and non-verbal. The candidate uses language that is understandable and takes into consideration the needs and characteristics of the patient. For instance, when you're discussing with an adult, the language you will likely be using will be very much different from when you're discussing with a child. Children don't always understand pain, the word pain. When you ask them, does it hurt? I've noticed that they understand the word hurt much more than they understand the word pain. You could ask a child, is it painful? And they'll be looking at you quite amazed, quite surprised. What does this doctor mean? Or if you ask them, does it hurt? They'll tell you no. So it's something I've noticed from my personal experience. When you're using words like urinate, or you can ask a patient, an adult, when you pass water, does it hurt? A child may not understand the phrase pass water or the clause pass water. You have to use the word like when you pee, or when you wee, or when you pee. So the phrases and the words you use in your communication should match the patient that you have. The candidate uses a variety of communication techniques and materials to adapt explanation to the patient. For instance, using images to make your explanation easier for the patient to conceptualize, offering patient information links or patient information sheets. The candidate uses the patient's understanding, agenda, health beliefs, and preferences to help tailor any explanation offered. The candidate works in partnership with the patient, negotiating a mutually acceptable plan, which is clear and understandable. As we said earlier, it's all about negotiating with the patient. It's all about being safe, being rational, and laying bare all the available options and guiding the patient in making a reasonable choice. The candidate checks the patient's understanding of the consultation, including any agreed plans. So it's always good to check that the patient has understood what you've told them. The candidate demonstrates an empathic approach, including a willingness to help and care for the patient, which is actually the hallmark of your consultation. As long as your goal is to help identify this patient's problem, and you want to help this patient navigate through finding solutions, as long as that's your aim, you will do a good job. Working with colleagues, the candidate works collaboratively, understanding the context within which different team members work, respecting their role and valuing their opinions. The candidate shows respect for colleagues, treating them fairly and without discrimination. For instance, you might be speaking with a nurse or a carer on behalf of a patient, and how you relate with them. When they ask you questions, oh doctor, should we do this? Doctor, I was wondering if we should need to prescribe him antibiotics because his cough is getting worse. How do you relate with them, even when you don't agree with their opinions? Practicing holistically, promoting health and safeguarding. The candidate recognizes and acknowledges the impacts of the problem on the patient, their family, and/or carers. You need to recognize, oh, this must be really hard. I can see a lot has been going on the last couple of weeks or the last couple of days. You've had to deal with a lot. How are you coping? How have you been coping? How is your mom coping? How is the family coping with all of this going on? The candidate challenges assertively on helpful health beliefs or behaviors, whilst remaining respectful and maintaining a continuing and productive relationship. The candidate recognizes what matters to the patient and works collaboratively to enhance patient care. So you need to establish what is important to the patient. What's really bothering this patient? What is this patient concerned about? What is this patient hoping to get from you by booking or by making that consultation? What is the patient's priority? You need to recognize that and address that. Understanding the standards. It's important to recognize these are not descriptions of candidate behaviors needed to pass in every case. For example, there may be no need to demonstrate ethical awareness in the relating to others domain. They are not a tick box for passing the examination. So it's not an OSCE, it's not an objective structured clinical exam where you must do certain things. No. It's an assessment. The SCA is not an OSCE, it's not a tick box. You mustn't ask about smoking and alcohol in all the cases. You only ask relevant questions. Okay? You have to be rational in your approach to everything. They are not a tick box for passing the examination. However, they are used by examiners to guide judgments and set grades and standards where appropriate for the case to enhance reliability and consistency. Reliability and standard setting. The examiners marking the case are carefully calibrated for the examination. All examiners are trained to mark in the same way, using standardized grade descriptors applied to a case-specific marking schedule. The 3 domains in each case may be weighted, meaning that the domains contribute to the overall mark for the case in different ways. It is expected the clinical management domain will carry more weight than the other 2 marking domains, as this links to more of the GP capabilities. Examiners will not be aware of this weighting for it to influence their marking. So the examiners will not be aware of, for instance, in some particular cases, data gathering might carry more. In some cases, management might carry more. In some cases, relating to others might carry the most marks. The examiners will just score you across all of those. Then, of course, those in charge of setting the scores and the passing mark will know the weighting of different cases. And then your own job, or our job as the examinees, as the people sitting the assessments, is for us to deliver safe, rational, competent, defensible management plans. Pass marks. The trainees' mark is determined by their performance across the whole assessment. Trainees will not have to pass a certain number of stations in order to pass. In addition to the marking of the individual domains, examiners will be asked to judge the candidate's general performance in each case. Their response will be carried forward to determine the pass mark for the case through a standard setting process known as borderline regression, meaning there is no fixed mark. There's no fixed pass mark for each case. It depends on overall performance. People that are within that cohort. So, for instance, all of the people that will do the exam in a particular month, based on their overall performance, that will determine the pass mark for each station or for each case. The borderline regression method is an established and appropriate model of standard setting for medical or ski type examinations. There are 4 global standard setting descriptors linked to fitness to practice. Pass clearly meets the criteria, standard desired for an independent, newly qualified GP who is safe to practice. Bare pass, minor errors or omissions, but generally good performance and will be fit to practice. So what you need is either bare pass or clear pass. Bare fail, presented some evidence, but insubstantial or incomplete, not done enough to demonstrate fitness to practice. Fail, minimal evidence presented or potentially puts the patient in danger. So you need to be safe, you need to be rational, you need to be competent, you need to be considering social and psychological impacts and management approaches. You need to be thinking about driving. Should this patient stop driving for the meantime? Should I be worried about this patient's driving safety? Am I worried about this patient's mood? Am I worried about the fact this patient is still smoking despite having peripheral artery disease, despite having angina, despite having had a stroke, for instance, or having had a TIA and the patient is still smoking? So these kind of things, you need to be thinking about these things. You need to be thinking flexibly and thinking wide. So that's all on the marking guides for the SCA, the Simulated Consultation Assessment. So thanks for sticking around for us to go through this together. Wish you all the best in this exam. Cheers, guys.